I am your moderator for today's panel. I'm Dr. Richard Gregory Johnson III, tenured professor of public policy and administration in the College of Arts and Sciences at the University of San Francisco. I'm also a very proud HBCU alumnus of Johnson C. Smith University, Charlotte, North Carolina, and I'm also a 30-plus year active member of Alpha Phi Alpha fraternity, Gamma Chi Lambda chapter, San Francisco alumni. I would like to especially welcome our HBCU students, alumni, parents, staff, faculty, and all others affiliated with HBCUs. At this point, it is customary, and I would like to set protocol by roll calling the Divine Nine organizations. And I will do this in order of founding dates. Alpha Phi Alpha Fraternity, Incorporated, 1906. Alpha Kappa Alpha Sorority, Incorporated, 1908. Kappa Alpha Psi Fraternity, Incorporated, 1911. Omega Psi Phi Fraternity, Incorporated, 1911. Delta Sigma Theta Sorority, Incorporated, 1913. Phi Beta Sigma Fraternity, Incorporated, 1914. Zeta Phi Beta Sorority, Incorporated, 1920. Sigma Gamma Rho Sorority, Incorporated, 1922. Iota Phi Theta Fraternity, Incorporated, 1963. Protocol has now been set. At this point, I would like to introduce Dr. Phil Gardner, AATCLC Chair and Co-Founder, as he brings us greetings for this afternoon's proceedings. Dr. Gardner, please.
Thank you, Richard, and welcome to everybody. Good afternoon and good evening. I'm welcoming you to join the fight that the AATCLC has been involved in for a long time. I know many of you have already been in the fight to save Black lives, but we are asking you today to join this part of the fight against the #1 killer of Black folks in America. And frankly, we cannot wait on the feds to do anything about this. We have to do this at the local and the state level. So please keep that in mind as we move forward today. This is the thought we have. If you're not in it, you're not in it we're in it to win it. That's what I'm trying to say. So with that, the African American Tobacco Control Leadership Council welcomes you. We would like you to sit back and enjoy a wonderful webinar. But remember, it's just not what we learn, it's what we do with the learning. We want you to take action. With that, I'll send it back to you, Richard. And again, welcome everybody.
Thank you so much, Dr. Gardner, and thank you for being a warrior in this fight and this struggle for years. And we greatly appreciate you, my brother. I will now briefly introduce our panelists for today. And I should say up front that these are just brief introductions. They are not as extensive as they could be with the panelists because these are some bad folks. They have been doing the work for years, and if I were to read their extensive bios, it would take us an hour or two, maybe longer. So, panelists, excuse me, but I had to chop your bios down, so don't get me afterwards. Okay, so here we go. Starting first, Dr. Valerie B. Yerger is professor in health policy at University of California, San Francisco. She is also licensed to practice medicine as a naturopathic doctor in California. For the past 25 years, Dr. Yerger's research and advocacy work have focused on framing the disproportionate burden of tobacco among vulnerable communities as a social injustice and informing public health policies to effectively reach and engage these communities. Dr. Yerger is, or Dr. Val, as we affectionately call her, is a proud member of Delta Sigma Theta sorority, Contra Costa alumni chapter, where she's held many positions over the years. Welcome, Dr. Yoga.
Can I just stop for a second? I live in Contra Costa County, but I'm a proud member of Berkeley Bay Area Alumni Chapter.
Gotcha. Thank you. Thank you so much. Well, you're active. That's the main thing. So thank you. Thank you, Dr. Val, for that clarification. Uh, Dr. Monica Wilson is an esteemed alumna of the renowned HBCU Clark Atlanta University, which, Dr. Wilson, I didn't know that until I just read your bio. So I was very excited to learn that. Uh, Go HBCUs. Again, she is a graduate of Clark Atlanta University in Atlanta, Georgia, where she cultivated her passion for advocacy and education. Dr. Wilson is a proud member of Alpha Kappa Alpha sorority. She currently serves as professor, clinical academic director, and regional representative for Parents Against Vaping, e-cigarettes, BAVE. A dedicated advocate in the fight against vaping, Dr. Wilson works tirelessly to end flavored tobacco products and protect the health of young people in communities of color. Through her leadership, education, and policy efforts, she continues to drive meaningful and lasting change nationwide. Welcome, Dr. Wilson. And again, as I stated before, we got some bad people on this panel doing the work. Next up, we have Mr. Charles Debnan. Excuse me, Charles. We went over this yesterday, I know. Charles is the Deputy Chief Executive Officer with the Community Wellness Alliance, located in the heart of the District of Columbia. Charles is responsible for the oversight of all health and wellness programs while building sustainable partnerships and community advocates and stakeholders. Charles also serves as the DC rep for the African American Tobacco Control Leadership Council, AATCLC, ensuring that the organization builds on and sustains its natural presence as strategic focus on the District of Columbia. Charles graduated from Fisk University and is a proud member of Kappa Alpha Psi Fraternity Incorporated. Finally, we have Dr. Gregory Bolden, who is a nationally recognized consultant in men's health, community organizing, cancer, cardiology, and diabetes. He currently serves as the Community Initiatives Program Manager for the Center for Black Health and Equity, serving to facilitate programs and services to benefit communities and people of African descent. Dr. Bolden has 30 years of experience in public health and in community medicine. He holds a PhD in community service, I'm sorry, in community medicine and public health. He holds a Master's of Science in Healthcare Administration and a Master's of Theology Studies. Dr. Bolden was initiated into Alpha Phi Alpha Fraternity Incorporated at the Beta Alpha chapter seated at Morgan State University. Colleagues, if you would please join me in welcoming our esteemed panelists. Dr. Yerger will kick things off for us, but before she does that, we will have a video that was done by by Police Chief Officer Scott, who addressed the third annual Menthol Conference. Police Chief Scott is also a member of the Omega Psi Phi fraternity. So we're ready to show that video, please.
I'm San Francisco Police Chief Bill Scott. As you gather for the third National Menthol Conference, I want to congratulate you on the progress you've made over the last 5 years. While there is a lot to be proud of, we are all aware that there is still more work to be done. For decades, the tobacco industry has targeted Black communities, specifically through the marketing of menthol cigarettes. Because of this, Black communities have seen thousands of lives lost as a result of tobacco use, and millions more whose lives have been impacted by the use of tobacco products. In 2017, the city and county of San Francisco became the first city to entirely ban the sale of flavored tobacco products, such as menthol cigarettes. In 2018, San Francisco voters overwhelmingly reaffirmed this measure after it was challenged by the tobacco industry. Since then, many other cities and states have followed San Francisco's lead and banned these products, which have been intentionally marketed toward Black communities and have exacerbated health disparities. The work you do this week will help move us closer to eliminating menthol tobacco products nationwide and move us closer to reducing health and equity disparities that so many in our community face. Thank you.
Thank you very much. That was just an awesome video, and it demonstrates the impact of one voice, um, and how they can change things just from one space that they're in. So again, a shout out to Police Chief Scott. We greatly appreciate him as an ally. Before I turn this over to Dr. Val for her opening statement, I want to just make sure I tell the audience the sort of flow of this evening's webinar. Each of the panelists will have roughly about 10 minutes to speak, and then to give us a statement, and then we will open it up for questions and answers, questions and comments from the audience, because I know many of you have those, of course, that's why you're here. And the way that that will happen is that you will put your statement or comment or question in the chat, and one of our moderators, either Josh or Camille, will read them to the panel. And again, just very quickly, want to shout out to Camille and to Josh and to Jess for helping us with this webinar. It's taken us a year to put this together, but here we are. We could not be more proud. So again, thank you to those three specifically. Dr. Val, if you would please.
Okay. Thank you, Dr. Richard. I am going to I'm going to give a little bit more than a statement. I just feel like I've worked 25 years and I'm due more than just a statement. I've been working on this issue, trying to get all of us together.
Well, you go ahead, Dr. Val, and do your
So
thing.
I'm respectful of my time. So Dr. Richard Johnson, you are freaking amazing. So thank you for moderating this panel. So hi, everyone. I know that our presence may have been an attracting force, but I'm also thinking that maybe the title of our webinar. So I want to address what might have brought you here, which is to discuss very, very briefly the relationships or the potential relationships between nicotine, menthol, and melanin, and to also leave you with understanding that the menthol cigarette is a major instigator of death and disease in our community. So before I really get into it, I want to ask, why are you here? We're hoping that whether or not you're actually doing tobacco control work, what has you really interested in the work that we're doing is that you care about our community and you care about other communities that have been underserved and under-resourced and provided the needs to meet the basic living needs, for our communities. And so Dr. Phil made a statement that was very similar to what I wanted to start off with, is this line, which is one of my favorite lines from the play Hamilton. So when you've got skin in the game, you stay in the game, but you don't get a win unless you play in the game. Oh, you get love for it, you get hate for it, but you get nothing if you wait for it. So however it is that you have attracted to this work, let that be the reason that you stay with this work. There is a place for everyone. We brought out the video of Chief Scott primarily because even though it was a few years ago at our third national menthol conference, he was very instrumental in us getting a jurisdiction-wide ban on menthol cigarettes and other flavored tobacco products in San Francisco, where the proportion of Black folks compared to the other groups living in San Francisco is basically 3 to 4%. And yet we were able to get people engaged. So we are calling for all hands on deck right now, because this is where we are. And I hope that after our webinar, you will feel compelled and understand how you have a place in this and why you need to find some way to help us get justice to all of us who are targeted by the tobacco industry. Whether we're talking about cancer, heart disease, stroke, diabetes, these are all smoking-related diseases which Black Americans are more likely to die from when compared to white Americans in this country. In fact, tobacco kills more Black Americans than AIDS, gun violence, accidents, suicides combined. Nearly 47,000 Black Americans die every year from smoking-related illnesses, which makes tobacco use the most preventable cause of death among African Americans. So let's talk a little bit about nicotine and menthol. Regardless of what you may have heard, menthol cigarettes are not a healthier alternative to smoking non-mentholated cigarettes. Menthol masks the harshness of tobacco smoke and the irritating effects of nicotine, which makes it easier for someone like a kid or a teenager to start smoking. And menthol makes smoking more satisfying for a person who regularly smokes. In fact, menthol makes it extremely difficult for someone who smokes menthol cigarettes to quit smoking. And menthol makes it easier for the tobacco-specific carcinogens to get into the cell membranes. And as my colleague, Dr. Phil Gardner, likes to remind us, menthol makes the poisons go down easier. And to understand how menthol contributes to the health disparities we currently see, we actually have to go to the previously secret tobacco documents. These documents reveal how for more than 60 years, tobacco companies have aggressively marketed menthol cigarettes in Black communities, resulting in a disproportionately high number of Black Americans who actually smoke them. The tobacco industry continues to focus on our children as a priority for their predatory marketing tactics. And as an example, we know that children aren't the only targets of the tobacco industry. Here's a quote from a pretty well-used document, but might be the first time that some of you have seen it. But thanks to these tobacco documents, we kind of like have a sense of what the tobacco executives are saying behind closed doors, like in this particular case where they said, you know, we don't smoke this, we just sell it. We reserve that right for the young, the poor, the Black, and the stupid. So we know how they feel about certain groups. This is an example of a document that shows that Lorillard, which was a little bitty company that nobody had ever heard about, but they had this brand called Newport. So this is back in 1987, and they knew that if they were going to compete with the Kools and the Salems, that they were going to have to center their marketing efforts in the low-income Black community. So we have all kinds of examples from the tobacco documents highlighting their specific marketing plans to get their products into Black communities in particular. And they knew that they had to do things that would be attractive, like having vans that were playing music, and they would blast this music outside of clubs very often, where young kids couldn't get inside the clubs, but they could hang out outside the clubs near these vans and get free samples of cigarettes while they were out there. We also know from the tobacco documents just how specifically and systemically the tobacco companies competed against each other. and what my colleagues and I called the racialized menthol wars. We were able to document using these tobacco, previously secret tobacco documents, just how the tobacco companies contributed to the health disparities that we're seeing today. And all of this is documented. I realize that I can't get into great details about this, but I wanted to give you a sense of it so you would know if you wanted to specifically ask us to come back and to talk and do a deeper dive of these topics, you could ask us by going to our website, which Josh will share at the end of our presentations. Also, the documents really shed light on one reason, at least one reason, why they targeted young Black men with menthol cigarette marketing. They viewed this very specific demographic as a powerful influencer long before we had social media. And they realized that if they could just get the young Black male to start smoking menthol cigarettes, that the rest of society would follow in his footsteps. And sure enough, that is exactly what we've seen over the recent years as the use of menthol cigarettes has increased among the youth of other races and ethnicities. The tobacco companies were extremely successful in marketing their products to us. As you can see from this graph, we started off as a community of smokers, smoking maybe 5% of menthol cigarette use among our smokers, and that increased by threefold in just a little over a decade, which increased another threefold another decade later, where we see today the numbers are at least 85% of those who smoke are smoking menthol cigarettes. Let me touch quickly upon nicotine and melanin. One of the reasons why I went into the documents to see what was going on in terms of melanin, I just searched, and sure enough, I learned a lot about what the industry was already researching about, and that is the role of melanin in helping those of us who have darker skin to get hooked to their products. I was interested in looking at melanin because we know that when we look at African American smokers, we have higher levels of cotinine. Cotinine is the byproduct of nicotine. So when you smoke it, the nicotine can disappear, but the cotinine stays in the blood and can be measured. And despite smoking fewer cigarettes than whites, we had higher levels of cotinine. And so I thought there's something else going on, especially given that other researchers were reporting that Black smokers appear to take in and absorb more nicotine than white smokers. So I started to look at this potential relationship that melanin may have in terms of nicotine. Melanin, of course, is the substance that gives us our skin and our hair its color. So we basically all have some level of melanin. And of course, this was something that I got extremely excited about because I started to find evidence of studies that have been done starting in the 50s. This particular example is a study that was conducted in 1972, but the tobacco industry had already had at least 10, 15 years of looking at this relationship between nicotine and melanin. And what we know from even just the industry research is that those tissues containing melanin accumulate nicotine. And so it's been more than 60 years that the tobacco industry has known this, and 60 years that they have been in our communities, and more than 60 years that they have been sponsoring events in our communities. And I am waiting for a single person in our community to say, oh, I knew about these studies because my buddy, this tobacco executive, told me about it. They're not disclosing this information to us. And so for those of us who are doing this work, we recognize the importance of educating our smokers. And yes, be informed. If you're going to still pick up the cigarette, at least be informed about it. And for those of you who have already picked it up, we have to help you deal with getting off of those products. So because
Excuse me, Dr. Val. I'm
Yes,
sorry, you're at time.
am I?
Yep.
Okay, all right.
You were a bit more than at time, but
Okay,
I
I
just
will
want you
stop.
guys.
I thought I had until 4 o'clock, but I'll let you take it
Uh,
over.
uh,
Okay,
Thank you so much. And then also, I'm sure that like I see some questions are coming in, so I'm sure
okay.
some folks will want to get back to what you're saying. Okay, thank you. At this point, we're going to have Dr. Monica. Dr. Monica, if you would, please.
Dr. Val, thank you so much. You've grounded, you have given us the root of our why that we are here today. Good afternoon, good morning, good evening, everybody, no matter where you are. My opening statement has to align with everything that Dr. Valerie just said. We are facing a public health crisis, and that's why we are here. This is truly one that's seeking not only where I'm passionate, I'm a mother, and our youth and our children are being targeted, and we cannot afford to look away. The nicotine and the menthol are not just harmful, they're deadly weapons. Literally, we know that are now marketed to our children. The slide that Dr. Val said has been going on literally for years. And now it's gotten to be so deliberate, so intentional that we have over 200.5 million middle and high school children and youth addicted to these products. It is absolutely egregious. This is not an accident. It is a deliberate strategy by the tobacco and vaping industry to create a whole new generation of lifelong addicts with all the health outcomes that Dr. Valerie already shared and then some, because we're also seeing the integration with behavioral health and mental health impacts with these products and what they're doing to our young people. The smooth taste of menthol, though it's toxic, they keep putting them in these devices specifically with the intent to get people the illusion that vaping products are a lot more easier because they're not actual cigarettes. They mask the poison. They're supposed to make it easier to inhale. They've added flavors. They've packaged them all with all sorts of illuminating um, ways to entice young people to want to use them. And of course, we know it makes it harder to quit and far more dangerous than we really realize. Every day we cannot hesitate. More young people fall to this addiction. I'm seeing it more and more and more. And every moment we delay, we allow industries to profit out of not only youth, but Black youth, college educated entities right now are really being bombarded with this, with sacrificing their health in order to deal with the coping mechanisms of stress and the abundance of how it's supposed to be cool and it's supposed to be less harmful than cigarettes. It's literally impacting a whole generation in our future. The time for awareness has passed. It's now time for action. And everyone who's here, no matter what side you sit on, I can tell you, like I said, up close and personal. I deal with young people every single day, and the parents who actually are completely just overwhelmed by the changes in their child's behavior, the isolation it causes, the changes in their grades, their lack of socialization, not wanting to be with friends, isolation, not being themselves any longer. We are seeing literally the effects that these products are having. So we have to do something. We must sustain this sense of urgency. From our silence is their gain, and our action is our only choice. Again, our silence is their game. It doesn't matter what political side that you lay on. It doesn't matter that you believe, okay, Dr. Monica, we have choices and all that good stuff. I'm here to tell you as a parent and as a professional, the impact that I'm seeing on these menthol vaping products, non-menthol products, all of these entities that are inhaling into our young people's lives are literally robbing them of their future, of their health, and of their well-being. So I'm coming here with a heart of open to any questions. Didn't have it long because it's coming from the heart. Didn't have no slides today. Didn't want to go that route. This is all about community. This is all about a call to action. And I'm truly hoping that all of you who are here will go to our websites to see the good work that each of our organizations do for those parents that need support or more education around the issues dealing with youth vaping, our organization, Parents Against Vaping E-Cigarettes, is here to support you around education, advocacy, policy reform, and whatever we can do. But more importantly, we have to save young and adult Black lives. Thank you.
Well, see, Dr. Monica, you just dropped the mic right there. You didn't need any slides. You just gave it to us. You said, "Here, take it," and we loved it. So between you and Dr. Val, you ladies have brought it already. That's why we put the sisters up front. No, I'm just playing. No faith, no shade to my brothers. No, but thank you both. We're gonna now go on to Charles, because I really would, if it's okay with the panelists, I would really like to have as much time reserved for questions and comments from the audience, because I think that makes a good webinar, right? And my apologies to Dr. Val. She corrected me. She had 2 minutes left, and so I'll find a way to give her back those 2 minutes, because if I don't, she'll get me. So, and I love Dr. Val. I don't want to be on her bad side. So I will make sure she gets 2 minutes back. I'm not sure how, but I'll make sure. Charles, if you would, please.
Sure, and thank you, Dr. Johnson. And I don't know how in the world I'm going to follow those two, but I'm going to do my best. So, good afternoon, good evening, everyone. And I do want to just thank the the host for inviting me to be a part of this this awesome panel and this very, very important conversation. And I just want to start my conversation or my dialogue with the quote. I'm going to pull it up now. All right, can you guys see that? Yeah, okay. So this is a quote by Dr. Martin Luther King Jr., and it says, "Our lives begin to end the day we become silent about things that matter." And I thought that this was so appropriate to start my conversation, not only because it's powerful, but because it's Black History Month. And I think that we need to acknowledge that, right? Because so many people want us to forget that. So I want to put that out there, happy Black History Month to us all. And so what this quote means to me is that saving lives, saving Black lives matter. And I know it's been really frustrating. It's been difficult for many of us who have been working in tobacco control and tobacco cessation for a long time. And even those that may be new to this, it's been frustrating and hard at times and difficult and somewhat depressing. But getting menthol banned on a national level, yes, it's been challenging, but we as a community, we continue to fight. We continue to scream, to kick, to cry, and yes, sometimes smile at those successes that we do have. We hear a lot of times of things that aren't happening, but there are some good things that are happening, and they're happening on the local level. We at AATCLC and all of us tobacco control cessation advocates, we continue the battle by focusing locally, passing menthol bans in jurisdictions and in communities, in cities, and states, and also resolutions, organizations. I think Dr. Val mentioned some of these earlier. Resolutions are being passed by organizations. So organizations, yes, can play an active role in combating tobacco and menthol. And this is where the work has shifted now more so than ever on the local level. We know that nothing's going to happen, at least for the next 4 years on a national level and federally. So our work has to be concentrated on a local level, on a state level. And there's been a lot of activity. There's been a lot of work and a lot of successes and a lot of challenges and a lot of frustration that's been done in those communities, such as, Denver. I think of Detroit, our friends in Minnesota, Washington State, Tacoma, Washington, in New York City, and our friends in Buffalo, New York. And we just got an email today from Dr. Phil where legislation is being introduced in Texas to ban flavored tobacco and tobacco products, including vape. So the work is being done on a local level, and that's important. And we have to keep that up. And now, and if you didn't hear your area call, don't think that you're not doing anything or that you can't do anything, because there are things that you can do. And you're going to hear probably a call to action. I'm sure the next panelists will get more into this, but on a local level, what can we do, right? What can you do? If you're new at this, or if you've been doing this for a while, well, some things that you can do is meet with community leaders like council members, aldermen, and other stakeholders in your community, and educate them about the issue of tobacco. Educate them about how it's harming the Black community and killing us at large numbers. Hold town halls where community members not only are invited, but community members participate in setting up it, and hosting it, making them feel a part of, and organizing it. Attend or host community events where tobacco use and cessation are addressed. Contact your local tobacco-free coalition. Get involved, volunteer, serve on a committee. Provide testimony when it's time to before your city council. And you can write op-eds in your local paper, like they did. I think I distributed one today that Dr. Phil sent me from Tacoma, Washington. So you can write op-eds. So other activities that AATCLC, and we partner with TFK, Tobacco Free Kids, and we partner with the Center for Black Health and Equity around poetry slams. This is an awesome way for our art community to get involved, to express themselves, and to be and spread the word about tobacco control. Menthol funerals. We've done one here in the District of Columbia, and they've been done in Buffalo, New York, and Atlanta, and we're going to do one in coming up in Chicago. That's another way that you can get involved. And if you want more information about this, Dr. Val mentioned that we're going to pop up, and I think Josh put the website link in the chat. Definitely reach out to us, and we can point you in the right direction, and we can definitely lend our support. And there's a lot of momentum that's going on a local level. And to keep that momentum going, we must continue to support each other's efforts. So I'm going to end this quote. I heard you loud and clear, Dr. Johnson. So I'm going to end with my next quote. And this is another quote by Dr. Martin Luther King Jr. And it says, "I say to you, my friends, that in spite of the difficulties and frustrations of the moment, I still have a dream. We still have a dream. We can still ban menthol, and it's going to happen." Thank you.
All right, Freddie, you dropped the mic as well. Excellent job. Sort of precursor to the call to action that we'll hear shortly. But thank you so much for your words, and most importantly, thank you so much for doing the work, for doing the heavy lifting out there in DC. So, brother, we thank you. We love you for it. Keep on doing it. Keep on doing it. And I know it gets tough sometimes, but we're all in it together. So thank you. And before we bring on Dr. Boda, of course, now the panelists must have known I was going to do this. I've got to give a special shout out to my brothers of the '06 because our last panelist is a member of the Alpha Phi Alpha fraternity. And so I just want to give a shout out to my chapter brothers who many of them are listening here in the Bay Area, my chapter Gamma Chi Lambda alumni chapter, and a chapter I've been in for about 15 years. And it's just a wonderful chapter that I get a chance to work and do things like this with the brothers. So shout out to those brothers, and shout out to all the alphas that are listening, and the Greeks and non-Greeks. So Dr. Bowden, brother, now you know you've got to bring it. We've had 3 great panelists, You got to bring it, brother.
Well, thank you. I don't have to say much. It's been said. So what I am here to do is to help you understand that there are resources and there are organizations that you see on this screen today, but also in our organization, which is a national organization that works directly in the communities. And it seems like I'm going to use this button over here. There you go. The Center for Black Health and Equity is a leading national recognized public health organization. Our mission is to facilitate programs and benefits to benefit communities of African descent. We do this by building community capacity, developing community infrastructure, and advocating for equity-centered policies. And doing that, the way that we do that, we do the training within the local with the local coalitions at the local level. And we also have a number of programs that we actually facilitate. And why is it not moving forward? And because of our work within the community, we've had a number of community successes. Many of you may not remember these, but Uptown Cigarette, it was a cigarette that was developed specifically for the African American community. They actually did research. They probably looked at our organization, our fraternity, because the packages were black and gold. They opened from the bottom. There were certain things that they did in the 80s and 90s that they just co-opted and put into cigarettes. But we saw that the smoking prevalence disparities rates went down in the 1990s. In the 1960s, it was around 43, 44% smokers. It dropped down to nearly half of that by the 1990s. They introduced X-brand cigarettes, but we fought back. We fought back. We had Chicago, Illinois was the first city to actually implement a buffer zone that would actually keep menthol cigarettes away from our young people. They actually established a 500 buffer zone around all of their schools so that the children would not be inundated. We also introduced Pathways to Freedom, which was specifically targeted toward the African American community for cessation. How else do we do this? At the Center for Black Health and Equity, we do a program every year. This is our 11th year of doing No Menthol Sunday. This year's theme is Clearing the Air. It's going to be held May 18th. Charles talked a little bit about the menthol funerals and the poetry slams, and we do coloring book parties. But our website is right there, is nomentholsunday.org. It's opening on March the 5th. But if you're having events, you can also use the hashtag No Menthol Sunday and your social media platforms, and we'll capture that for you. We have this coming up in September, the State of Black Health, which is this year's theme is a call for health justice. And we all know that we need a little justice going on right now in this environment. So the registration is now open. We're actually calling for abstracts, especially from HBCUs, but anyone can submit an abstract, and the abstracts are due on February the 28th. And you can actually go to our website, centerforblackhealth.org, and download the prospectus for the sponsorship and also the abstract application. One of the most important documents that we have produced at the center has been the Health Justice Guide. The Health Justice Guide takes you through a history of tobacco and how the tobacco industry has inundated our community and has used us from slavery to today's environment, where they use their marketing, their predatory marketing, they disenfranchisement, they disinvested the communities, they co-opted our leaders, and they actually infiltrated our communities to the point where now they actually have folks believing that the poison that they're putting in their body is for us, and it's because it's not just for us, but it's to the point to where they can actually get us to fight each other to put the poison in the body. So those are the Health Justice Guide, and I would encourage you to go to our website and download all of these documents and get more information, because I'm going to run out of time. Now, here it is, the call for action, ending the sale of menthol cigarettes and other flavored tobacco products in all products, the statewide. A number of our D9 organizations and public health organizations and healthcare organizations have signed resolutions in order to support this effort at the national level, also at the state level, and to end and eliminate menthol. Now, let me say this real quick, because in this call for action, you need to understand that the fight is not against the smoker. It is not against the smoker. We love the smokers, even though we may not love what they do, but we do love the smokers. And we want to make sure that we're not inundating them with more and putting more stress on them that they're already under. We want you to understand that our fight is with the commercial tobacco industry. They're the ones who are targeting us. They are the ones who are putting this product in our communities. They're the ones who are targeting our children, our young people. They're the ones that introduced and promoted hookah and vapes and lozenges and other nicotine delivery systems. They're the ones who are our enemy, not us, not each and every one of us. We want to thank the folks who actually kicked these resolutions off. Delta Sigma Theta Incorporated, Sorority Incorporated. They were the first to actually sign a resolution, and they've done two. They did two resolutions that set the tone for all of the rest of us that followed them. These sisters and have built their fortitude. They have adapted the resolutions. They put it in place. They shared it with each other. They shared it with other D9 organizations. They shared it on campuses for HBCUs. Just about everywhere they went, they actually shared this information with us and set the tone for actually helping others introduce resolutions. The Bay Area Black Nurses Association in January 2016 adopted a resolution calling for the FDA to ban menthol, requesting state and local governments to restrict the sale of menthol cigarettes. The NAACP, and this is very interesting because they, from past, they had taken tobacco industry money, but in July of 2016, and again, in October of 2016, the National Board ratified their resolution calling for the ban of menthol cigarettes and other flavored products in all products. So that was the NAACP. These are folks who are leading the way. Alpha Phi Alpha Fraternity Incorporated. Actually, the National Board ratified our resolution on August the 3rd of 2023, and support the ban on manufacturing, sale, and marketing of menthol-flavored cigarettes. Missed one. National Medical Association, our docs joined in, and they also joined in on a suit against the FDA. The 100 Black Men of America. So you can see these are national organizations that are standing with us, and I can't emphasize enough how important it is for us to fight together against the tobacco industry and not each other. We are standing in solidarity. And here the National Council of Negro Women, just last year, in October of last year, at their 61st National Convention, supports the ban on manufacturing, sale, and marketing of menthol cigarettes and the flavored tobacco products and e-cigarettes. They actually called out e-cigarettes. So these are folks who are doing the work. They're actually on the front line. Here's our call to action. I want you to hear me now. This is from John Lewis. Get in good trouble, necessary trouble. I want you to hear me. In the book of Hosea, it said, my people are destroyed for lack of knowledge. We've given you knowledge. We need you to stand with us. All the D9 organizations, we call upon you to actually establish your own resolutions and stand with us. We call on public health organizations to stand with us and establish a resolution. We call on the HBCUs to establish resolutions. And guess what? You can do a resolution in your family that says if you have a smoker, you will support your smoker and help them get into cessation programs to give up those products. We need you at the front line and the back line. Everybody can't be out there out front, but everybody can support. We want you to actually consider starting coalitions so that you can train and work together and build upon what you've learned today. I want to end with this note. We don't have a year. We don't have a month. We don't have a week or a day. But in the words of Benjamin Elijah Mays, we all have 1 minute. And eternity is in it. And we can move forward all together in unity, in love, and all get in some good trouble. Thank you, John Lewis. A good Sigma man. I turn it back over to you, brother.
Thank you, brother Dr. Bowden. I was about to start passing the plate. Thanks
As long as it's got a resolution in it, I'm fine with it.
That's brother. You did what the other three panelists did. You dropped the mic and you provided us knowledge, and we can't ask for anything more than that. That was just outstanding. I mean, again, to all of our four panelists, the presentations were just amazing. Before we open it up, I do want to open it up to questions from the audience and comments. I do want to give Dr. Val her 2 minutes back as I promised, but just 2 minutes, Dr. Val.
I'm not going to even feel a need to take it because everybody kind of filled in. I feel compelled to say that Dr. Johnson, you invited me to one of your chapter meetings and allowed me to speak.
That's right. That's right.
And as a result, you're now involved, your chapter's involved. And I want to just really stress how important it is to just have a moment to just share the information. Very often we come up to resistance, our own people. One is not only do they not understand the issue, but they may not be smoking, because those of us who are educated, the likelihood of us being someone who smokes is less than our brothers or sisters who are struggling with the inequities that we're faced. So we don't see it as a problem because we don't see it. It's not in our home. But we are caretakers. We are gate watchers of our community. It is an issue. But the other reason why we don't necessarily think it's a big issue, because someone that looks like us is telling us it's not an issue. Because if we ban menthol cigarettes, we're going to have issues. There's going to be increased criminalization of Black and brown men. There's going to be increased influx of illegal cigarettes. We hear that. There's no evidence for any of that. That's one thing. But if you hear somebody saying something to you that doesn't really align with what you're hearing now, you got to dig deeper, because there very often is a trail of money to the tobacco industry. And that's what we're fighting. We're not having that conversation like we should, because once we call these folks out and recognize that there's conflict of interest involved here, at least let them just, we need them to be silent, not us, because we have our community that we need to continue caring for. And that's in the oath of many of our organizations.
That's right. Thank you, Dr. Val. That was perfectly well said. And if I would like to encourage the audience and invite them to start preparing their questions for the chat. And I'm not sure if Josh or if Camille or if they're moderating the chat, but one of them is, and then they will ask us a question. Dr. Val, so two things. One, I want to piggyback on something that Dr. Uh, Bolden just mentioned about the D9s and the other organizations, but I want to speak specifically to the D9 organizations because a lot of folks they see us stepping and sort of picking fun with each other, and all of that is in fun. It's playful. However, rest assured, and let's make no mistake about it, whether you wear pink or red or blue or black, we are all fighting for the same cause. We are Divine Nine. So in other words, um, let's make like so if you're outside of the D9 organizations, you might think, oh well, the Kappas don't get along with the Omegas and the this and the that. That is incorrect. We all get along. We all strive for the same color because see, what will happen is that when we get to that judgment day, God is not going to say, what colors were you wearing? He's going to say, what work did you do? See, uh, Dr.
And you want
Bowden,
me to address that? I would say to you, as a former president of the National Panhellenic Council for the Bay Area, you
yes,
you can talk about the collaboration spirit
mhm,
between those of us and these
that's right. That's
organizations.
right. So thank you, Dr. Val. So I'm going to, again, before we turn it over to the audience, I'm going to raise a question for each of you to speak. So Dr. Val already mentioned this a little bit, but my question to each of you, very briefly, if you would, how did you come to this space? So for me, as Dr. Val just said, she pulled me along because I am a scholar. I'm what's called a social equity scholar. So I research in the areas of race and social justice and social class and those types of things. And Dr. Val was like, you got to come and be a part of this work. And I'm like, Dr. Val, I don't have time for anything else. She said it doesn't matter. She is responsible for me being here, and I have been in this space for now several years. And I credit her and I love her for it because if she did not, I mean, I've never been a smoker, so it has never really been an issue to me. But my parents were smokers, they were of that era, right? Even though they stopped eventually, but I think the damage had been done to their bodies, unfortunately. So it was Dr. Val who put this in my mind that yes, I could be a part of this work as well. And Dr. Val, I love you for it. This work that we are doing here is one of my greatest work. So I thank you. Yeah.
Well,
Um,
can I just respond to that? And I'll be the one, and
yeah.
then I'll give everybody else a chance. It's important for us to do this work in a way that we can do it in the space where you
Hmm.
already are at, instead of getting into another space, which
Right.
is what we're doing. You don't have to come and get over into our space. You can bring your space to where we are so that we can find ways to collaborate. We are all stressed. We are all doing a lot of work and taking on something that is being pressured upon us by this beast of an industry is more than a lot of us can handle.
Mm.
But there are times where we can come together and we can find those opportunities of joy to do the work that we can do, because in a place of joy we can think, we can create, we can collaborate, we can talk about, oh, if I do a little bit here and you do a little bit there and you do a little bit there, we can work on this. And you can find ways to support those of us who make this our space and make it
That's right.
something that we do daily. So that's my response to your question, and I'll listen.
Thank you, Dr. Val. That's awesome. Okay, panelists, in any order that you like, please. If you
There are
would
a
just briefly
number of
state.
questions coming in on the Q&A. So if you click on
Yeah.
that, you'll see all the questions that are coming in.
Well, Josh, would you be able to just read the questions to us, please? Because I would
Sure.
have the capacity to do that. So since there are so many questions, let's go ahead and panelists, excuse me for changing route from the question I had for each of you, but let's go ahead and take the panelist question. So, Josh, if you would, please.
Sure. So I'm going to read the first question.
Thank
What
you.
are the most effective strategies for enforcing stricter tobacco policies in schools and communities to prevent youth access?
Good question. Okay, anyone can jump in.
There are a lot of strategies that can be utilized when you're talking about the schools within the schools. If you do it in the absence of the students themselves, you're probably not going to be effective. Because we've told them how dangerous this is. And I've worked with youth on a number of occasions. And it seemed like with the youth, the grosser it got, the more engrossed they were. And they would just gravitate to it. But you actually have to listen to the youth and listen to the students. If you're just going to have a program where you say, oh, if I catch you, if you get caught, you're going to be suspended, that really doesn't work, because all that does is that gives the youth more opportunities to go out and do whatever it was that you just caught them doing. So there has to be an opportunity for you to engage the youth, to have an educational program, and to actually listen to them and develop programs that they're going to adhere to. Just beating them over head is not going to work. So I would say include the youth and listen to them and engage with them and have real conversations.
Thank you, Dr. Baldy. Anyone else?
Yes,
Dr. Marco?
I would like to add, thank you, Dr. Bolden. I would say also for the administrators, teachers, those parents who say that's not my child, that's not happening in my school, or if the problem don't exist, don't create it, Dr. Monica. I say be open to allowing for educators and advocates to come in to tell you and explain to you the reality of what's going on, and allow, as Dr. Bolden stated, the youth to come in and just be honest. I can tell you, doing these workshops, trainings, and being a parent, that most of the time it's burying your head in the sand. And then when things happen, trying to suspend students, they shouldn't be suspended. That policy right there is going against prevention and intervention with a health issue. And so being able to address this and implement educational programs in the schools, obviously working with community organizations, and then also educating and supporting the parents, because that's normally, it's the ping pong. Who's going to take responsibility for the child? Well, no, we all, as a community, all hands on deck. As I said in the beginning, everybody should have peer support programs that educate and promote advocacy and spaces for young people to talk. There needs to be, like I said, other structures within the school, and not look at this as deviant behavior, but understand the targeting that's taking place with these young people and how addictive these products are. And once they start, how they're getting hooked younger and younger. I have a 6th grader right now that's literally going through withdrawals, had been vaping 1 pen and had a panic attack, anxiety attack, and their parents are now involved, but the school didn't want to address it. We have to change and open up the dialogues, and also promote more youth leadership. The advocacy in this arena is so profound. The youth voice is the voice. I always keep my ear on what they say and don't talk about what it was for me. Well, back in the day, we know they do not want to hear none of that. So I make it to a place where not only is it just the health harms, because I'm sure that back in the day, the tobacco industry understood that, cigarettes cause lung cancer, but how many people, as Dr. Val showed earlier, actually still smoked? That doesn't work. Informed and allowing for them to understand what is actually happening and how the targeting component of this, and then also the cost associated with this. So the policies start, like I said, at the local level within the school environment, changing the education aspect, getting the young people involved, and supporting parents and helping them understand. It doesn't have to be your child. It could be your child's friend. And trust me, as I mentioned, almost 3 million middle and high school students are vaping right now. So we know it's there. Thank you.
All right, again, Dr. Monica dropped the mic. And what I appreciate, I think what we all appreciate about your comments, Dr. Wilson, is that, you come from a therapist, counselor background. So, this is what you do, right? And it's just, but still, there's that great sense of passion that comes out of your words. So we thank you for that. Um, why don't we move on to another question, please?
Sure.
Unless Charles or, okay, let's move on to another question, please.
And there's some great comments in here, but I'm just going to focus on the questions.
Okay, terrific.
Next one, are the largest tobacco companies importing the Graba/Fronton products, or is it imported by Black entrepreneurs?
Okay, let's give Charles, Dr. Bolden an opportunity to weigh in on that question if they like, please.
I do not have the answers to that.
And
Oh.
I was waiting for Dr. Holding because I don't either. As a matter of fact, I read that question while we were waiting, and I was like, wow, I've never even heard. There's new things popping up all the time. So
Wow.
I read that was one of the things that I thought of.
And here I am starting with both of you.
Because it was brought up, I think it's very important for us to explore that.
Well,
The person
yeah.
that put that question there, thank you so very much, because this is also a learning experience, not just for us, but I mean, not just for you, but for us as well. And I really do appreciate you putting that question in. Now I've got to go back and do some more homework.
Well, Dr. Val, Dr. Monica, do either one of you want to take it?
Well, I can tell you what came up for me because I don't have
Mhm.
any information to share with that either. Is if the person who put that question in the chat has an answer to it, there's a way to get a discussion going. So I would say if you have some information, can direct us where we can get that information and look at it. We can do our own research and broadcast it wide out there and speak. So please help.
Maybe that participant can put that information in the chat and that can be captured. So that would be amazing. And Fred, I love what you just said. This is a learning experience, not only for the participants, but for us as well, right? I mean, because we all must continue to grow, because things are, Dr. Monica, something that you said earlier, which I think was so profound, and I find myself slipping back into this, which is when I'm talking to like my graduate students who are significantly younger than me these days, or my college frat brothers, or whatever, I find myself slipping back into, oh, this is what we did back in the day, and not understanding that this is a new day with new challenges, right, and new experiences. So yeah, that's something to consider. Josh, what's the next question, please?
Yeah, and just a little bit of context on this.
Yeah.
Person wrote in the chat that she learned about this product at DSU in Delaware, and the young
Mm,
people are using it along with their weed, and they
mm.
think it is natural.
Well, folks are writing. I see Charles taking notes, and this is really quite interesting. I had not heard of it either. So whoever the person was that put that in the chat, thank you so much. We will definitely explore that. Hmm.
Yeah,
Another
I did
great,
a focus group in Long Beach a few years ago, which is where I learned from a young person who was participating in the focus group how they made their weed orange flavored with an orange. She demonstrated it for me. So we know that the kids kind of do innovative things. That's why we need to be engaged with them. That's why we need to not be to judge them. We have Dr. Karen Beard who's on. I don't know if she's still on, but Dr. Beard is,
Hmm.
don't call anybody a smoker. We got to stop that. We have to call them people who smoke. There's a difference, and people hear it differently if they are
Hmm.
using the products. We need our people who smoke to help us in this work. We have to make space for them to feel accepted and loved so that they can help with the work that we do. And we have to compensate them. So we need resources to be able to do that. We can't just, exploit our own people. We have to make sure that we provide resources for them as well.
Amen.
Richard, Dr. Val, this is Phil Gardner. I put in the chat the history of this product. You can also put it in the answer thing, but people should take a look at it. Gives you a sense that, quote, this is real tobacco, unquote. And if you want to use something healthy, unquote, use this. So yeah, things are moving at a pace where, as we sit here as tobacco experts, we've never even heard of it. So good question by the person. Please look at what I posted there, and we'll have to, next time we talk, we'll have to take it up.
Thank you, Dr. Phil. Appreciate that. And again, Dr. Phil, as we all know, has been doing this work for years. Dr. Phil, I won't say how many years, but it's been a long time. You started very young, we know, and you're still doing it. So, brother, we love you for it. Also, Dr. Val, you just mentioned Dr. Karen Beard. Want to shout her out. She is a member um, of the council, AATCLC, and also a member of Alpha Kappa Alpha Sorority Incorporated. So thank you, Dr. Beard, for being with us.
So the next question, I'm definitely seeing this. I know so many others. The tobacco companies are pushing messaging saying that they're in the harm reduction game rather than the tobacco addiction game. And folks are wondering whether or not this is happening as well with menthol related tobacco products and how the panelists are working to tackle that messaging from the tobacco industry.
Wow, these are great questions. Okay, panels, who wants to jump in first?
Oh, okay. So I'll jump in first. First of all, let me say, if there is
Brad,
no
I wasn't looking at you. I was looking at one of the ladies.
that's okay. I was chomping at the bit. There is no level of either smoking, vaping, secondhand smoke, third-hand smoke. There's no level of that does not do you harm. The fact that the tobacco industry is co-opting our language as public health advocates around harm reduction. The only way you can have harm reduction is not smoke, not vape, not hookah, and not have folks smoking in and around you. That's the only way you can have harm reduction. And the simple fact that you're going to probably hear more of this, and I tried to stay away from this, but I guess I really can't, is that the president's chief of staff is a former lobbyist for the vaping industry and for the tobacco industry. And I saw in there where they spoke about RFK Jr. Look, I can't say this enough. They're not going to help us. We have to fight at the local level, at the state level. We've got to fight for ourselves and make them do what's going to stop them from killing us. I can't put that any clearer. We've got to make them stop killing us.
So can I add something to this? Because we do need to provide services that are culturally, community appropriate for our family members, our loved ones who smoke. There's no doubt about that. But having another tobacco product is not the answer. The research will show that very many of the individuals who try to quit and they're using these other products as harm reduction end up continuing the use of combustible products anyway. They don't quit smoking. I have watched people who vape testify at city council meetings talking about how long, talking about the need for flavored vaping products, and then disclose that they've been vaping for 6-7 years. That doesn't sound like harm reduction to me. So even by their own admission, these products are not helping them to stop smoking.
Thank you, Dr. Val. Okay. Anyone else?
Yeah,
Okay.
I just want to jump in real quick and just say menthol has been used by the tobacco industry as a form of harm reduction, whether they have said it or not. That's why it was introduced to make the medicine or make the poison go down a little bit easier. So when you think about it, that is a form of harm reduction, and they won't say that, but right. So they're so they've introduced other things to kind of take the place of that. So it's yeah, menthol's been used as, and we know it's not, but it's been introduced that way for a while.
So panelists, I know we probably have about just 12 minutes or so. So I think if we could try to get 2 or 3 more questions in very quickly, that would be great because the questions are coming in to the chat. But I do have a question for the panelists, if you would please. Um, this is something I don't think we talk about a great deal, but I think it's important. And the question is, how do people who are impacted by secondhand smoke go forward and try to make a difference? So what specifically I'm talking about, like kids that are in a household where the parents are smoking, or a spouse where the other spouse is smoking. Um, and so I'm saying this uh from a personal perspective because my brother, who I love dearly, my sister-in-law, I love her dearly, but she is continuing to smoke menthol cigarettes, and my brother has never smoked. My concern is for her health also, but my concern is for his health as well. So what say the panelists, please?
You know,
So,
I hear it a lot too. Sorry, Dr. Bolden, did you want to go?
no, go ahead.
Okay, I'll make this brief. And I hear a lot, I hear this a lot. And I do a lot of cessation classes here in DC. And a lot of times the people who do smoke will bring their kids with them, right, for support. And they are the advocates, right? They tell their parents, look, I need you to stop smoking. I'm sick of the smell. You don't sound right. You still have this cough.
Mm,
Whatever the case, the kids nowadays are telling their parents that, they want them to quit smoking.
mm-hmm,
And that's a powerful message.
mm-hmm.
It is. And I
Good,
think
Dr.
we have to
Charles.
begin with the premise that it is an addiction. We
Mm,
don't treat it like an addiction, but
mm,
it is an addiction. And it's different for everyone. People quit for different reasons. It may be their kids, it may be their grandkids, it may be that they want to walk their daughter down the aisle when
mm,
they get married. It may be because there's a particular illness uh, that they are facing now because of their smoking.
mm,
People quit for different reasons, but
mm,
for the longest time, we did not want to treat this as an addiction.
mm,
Because we did not do that, then that opened up pretty much Pandora's box, and it made it look like, again, we were fighting the smoker and not the industry. And so if you're coming at somebody telling them, say, you know what, you need to swear, you're screaming, hollering at them, it really is not effective
mm,
because the smoker, like any other addict, will dig in.
mm. Yeah.
But it's patience, love, it's understanding, it's communication, all of those. But when we're doing well, I know for me, when I'm doing my cessation class, I make sure that everybody gets a water bottle. I ask them to drink more water, and I give them a water bottle, so for them to flush out the nicotine out of their system. I tell them, go for walks when doing different things. I tell them about the 5 minute rule. If you can delay for 5 minutes, there's a possibility that you'll bypass that cigarette, that moment, that time. But there's just so many different ways of doing it, and I think everybody is different. And
Mhm,
you just have to explore different ways. You actually utilize pathways to freedom. You can
mhm,
access the quit lines. You can access local cessation programs. And like Dr. Val said, if you can find one that's culturally specific, like I know the one that she mentioned, Dr. Beard, uh, earlier. that like the one Dr. Beard has developed and we piloted, then you probably have a better chance of success in meeting the needs of that smoker.
I think that's great, Frat, and I appreciate that. I'm going to just follow up with just a quick comment, and then we're going to take another question because we only have 10 minutes left. Um, I just want to make this observation. I'm sure it's not, lost on a lot of people that are attending this webinar that, most people almost all of the people on the panel are well educated, right? And we occupy that space, right, where there's privilege that comes with, kind of what we do. And so, the question to each of you is, if you're talking about someone black or brown from like the inner city or from like the projects or something, like how do we draw them to this space? Because they could very well, turn around and tell us, well, you guys have this degree and that degree, and you have this amount of money, blah, blah, blah. You don't know how it is to be me, you know, in this space that I occupy, right? Just trying to make ends meet, right? So how do we bring those folks to the table?
I let them know I'm just like them, and you know what I mean. They're just like me. And full disclosure, I'm an ex-smoker. I quit over 35 years ago, and I put that out there in the very beginning so that we connect. You know what I mean on that type of level. And once they hear that, they're drawn in because they want to know, how did you quit? And
Mm,
what made you stay quit so long? So that starts the conversation. So regardless of the degrees, they don't even know about that, right? So
mhm,
they I come at them at a grassroots level and talk about the quitting and how in
mm,
my journey.
mhm. I think that's great. Okay. All
So
right,
if I may add
Dr.
to
Bell.
that,
Uh-huh.
so I've, this is not my day job. I have a job. So working
Yes,
on the
you. Yeah,
menthol
that's good.
issue and trying to get this product out of our community has become a priority, primarily because I saw the documents. One of the things that I was working on, which led me to meet Carol Magruder, who is also a founding member and a co-chair of the AATCLC, is that we discovered that if you take some of these tobacco documents and you put them in front of a smoker, they get pissed and they want to do more. And we actually had a couple of studies that were funded by the Tobacco Related Disease Research Program, which is how I met Dr. Phil, to really look at that and to engage people who smoke and the San Francisco Bay Area and get them to look at these documents. We created a cessation program, but it's been on the back burner because we've been a little busy here. And we have been all up and down the state of California, and we
Mhm,
know that the curriculum is effective. We know that it's effective when you show up um, at a shelter for women and you get
mm,
an email a few
mhm,
weeks later saying, oh, guess what? We no longer call our break a smoking break. We
mm.
changed the name of our break. They did that on their
Oh,
own.
wow.
So, we
That's
let
awesome.
them, our people who
Yeah.
smoke don't know
Yeah.
about the industry, and it can piss people off. People get pissed off, they get motivated.
Mhm. Well, thank you so much for that. We have really time for just one quick question. Josh, if there's a quick question in the chat.
So I'll take this as the quick question. What are folks' thoughts on nicotine replacement therapy?
Mm. Oh, that's a good one. That's a good question. Okay, who wants to take that? And let me say, panelists, not all of you will be able to answer. So we have like just 6 minutes. So unless, you guys can do it very quickly. So who wants to take that?
I can take it very quickly.
Thank
Make
you,
sure
Dr.
you know
Bell.
how to use the products. We find that even when it comes to nicotine replacement therapy, if your doctor's telling you, we already know that we get in, disproportionate time of the doctor's attention. That's
Mm.
well documented. So just make sure that you understand how to use the products and to use them appropriately.
And again, I just want to make sure I emphasize the fact that we have a doctor on the panel, Dr. Val, and you've also served as a midwife and these types of things, right? So you are bad. You just go ahead and do it. Yes, go ahead.
I can't do it all.
Yeah, well,
I want to go
apparently,
back to focusing on wellness.
yeah.
I want this menthol taken care of so I can get back to helping people get well so that they don't want to smoke. That's what I
Well,
want to do.
between you helping with the physical aspects of a person and Dr. Monica helping with the mental, we're covered, So, uh, no, not that I'm leaving the brothers out. Okay. Um, uh, guys, what do you want to take that?
No, I think Dr. Val did an excellent job.
Okay. All right. That's good. So, all right. So, um, at this point, I would like to thank everyone for coming. This was more than we had hoped for. This was amazing. And folks, if you could just give a closing comment, a quick comment, then we'll wrap up, please.
You can call on us.
No, just okay. Well, all right, Dr. Val.
um, so I just want to really emphasize that there is a place for you to do this work. In your local communities, there are advocates, tobacco control, tobacco prevention advocates already working there. Just join up with them, or if they come knocking on the door, answer the door. If they call you, answer the phone, talk to them about it. If you need some additional help, savingblacklives.org is the AATCLC website.
Thank you. Thank you, Dr. Val. I'm going to go in just order of my screen. Dr. Boldy?
First of all, let me say thank you everyone for joining us this evening. It is evening here in Atlanta.
Yes.
And I just want to put in a plug for our State of Black Health. At the State of Black Health, we normally have a D9 breakout. Plus, we also do a menthol academy. So if you want to learn more about what this menthol scourge and have open conversation, open dialogue with others in the field and in the communities, I would encourage you to just go to our website at centerblackhealth.org and just
Josh put
download.
it in the website. I mean, Josh put it in the chat.
Yeah.
Yeah. Thank you. Thank you, Dr. Baldy. Mr. Charles?
Yeah, I just want to kind of piggyback on what Dr. Val said and what Dr. Bolden said. Definitely get involved. Seek out the area. I think I mentioned this when I talked. If there's a coalition in your area, have conversations with your council members, your other stakeholders in the community. And definitely go to the savingblacklives.org. There's a lot of resources on that website that can help you get started. And one of the things that we did start on that website with the help of Josh is that we've done a mapping of open campaigns that are taking place around the country and it has contact information on there so you can reach out to that person or you can reach out to AATCLC directly and we'll point you in the right direction.
Thank you, Mr. Charles. Dr. Monica?
And just really quickly, thank you all so much for joining. We had over 100+ entities here, and it's just so exciting to see. I want to say, literally, we have been having the Parents Against Vaping E-Cigarettes Clear the Vapor conversations. And we are actually having one next week on Wednesday the 26th at 1 p.m. Eastern Time. And this is for awareness to action, how to advocate against vaping. Literally is going to be the topic. We have a wonderful expert that's going to be hitting some of the questions that we weren't able to get to in the chat. But this is an opportunity. Where do you get involved at the local level? Partnering and being able to connect with community organizations locally and also partnering with those who already have resolutions are really essential. I'm calling on all of every one of our Divine Nine should have been on that resolution list. So I'm speaking on behalf of my own. We need our resolution, and we also need to support each other. So please, I encourage you all, go to the websites, the links. I was trying to respond to some of the questions also in the chat. And this conversation will continue. There are wonderful free resources available, organizations out there doing amazing, as you heard. And we are here to support, educate, advocate, and continue the good fight, as these tobacco industries are not letting up. Either will I or we. Thank you.
Yes.
Love it. Thank you, Dr. Wilson. And I will conclude by just again thanking each of our amazing panelists. I want to thank uh, Josh and Camille and Jess for helping us to put this together. Again, it took us a year to get to this spot. Want to thank Dr. Phil and also Carol Magruder. This has been, again, more than we envisioned, more than we hoped for. It was spectacular. I'm going to put a plug in for something that I'm doing along that goes with this. I'm the newly elected president, as many of you know, for the HBCU Northern California Coalition, which I'm very excited about. If you are an HBCU alum or affiliated with the HBCU, we would love to have you connected with the coalition. Josh or Camille can put my contact information in the chat, and please contact me. We have probably about 125 people involved with the coalition. We meet once a month, and we try to do the heavy lifting. So, and on that note, I will thank you all so much. This has been amazing. Thank you. Thank you so much.
Charles, can you say something about the advocates meeting or?
Yeah, I sure can, and I'll make it real quick. Thank you, Dr. Val. So, AATCLC hosts a National Tobacco Control Advocates list or meeting and group of people where we come together every other month to talk about what's going on in our areas, pretty much kind of like what we're doing here, and just talk about the tobacco control, tobacco cessation, and lend support to each other as we tackle this menthol thing.
Good.
There is information, I think, about that on the website. We'd love to have you join. Reach out to us, and we can get you connected.
Good.
All right.
All
Bye,
right.
everyone.
Thank you, everyone.
Thank you, everyone.
Awesome. Take care. Bye-bye.